Hello. First and foremost, my team would like to say thank you for having this opportunity available at NSU. My name is Ariana Fine.
Hello, my name is Luis Quinto.
Hi, my name is Alexandra, and today we'll be discussing strokes and preventative measures as well as new therapeutical approaches.
Without further ado, let's get started in the presentation. So the topic we decided to focus on is stroke. While there are several definitions for stroke, we defined stroke as a cerebrovascular accident, a condition where blood flow to the brain is disrupted, causing lysis of neural cells. The disruption in the brain can be due to a blockage or rupture in blood vessels supplying the brain, according to the study. Understanding this process is essential for recognizing the severity of stroke. So there are two types of stroke, ischemic and hemorrhagic. So ischemic is the most common, accounting for about 87% of cases. And this happens where there is a blood clot which blocks a vessel in the brain. And we're going to talk about this more in depth as well. Overall, hemorrhagic stroke is when a blood vessel in the brain bursts, causing bleeding within the brain or around it. In mortality, stroke is one of the leading causes of death worldwide. The statistics reveal how significant this issue is. Additionally, strokes are a major cause of long-term disability. Many survivors face challenges in their daily lives affecting their ability to work and engage in social activities. The healthcare costs associated with stroke are also substantial, causing a lot of issues for people worldwide. My partner is going to lead into the next section and discuss more in depth about ischemic stroke and hemorrhagic stroke. Thank you.
As Ariana had previously stated, we do have two types of strokes, ischemic and hemorrhagic. Ischemic is going to have two causes. They're going to be embolic or thrombotic. Ischemic strokes do account for most stroke cases resulting from those blood clots. Embolic is going to be a blood clot traveling from some other part of the body to the brain, and that's what's going to cut off oxygen flow. And then thrombotic is where the blood clot forms in the brain area more locally, and it's due to fatty buildup. This lack of oxygen is going to cause neuronal cell death in the brain, and we want to minimize that as much as possible. So we want to make sure that we are addressing it as quickly as possible. For hemorrhagic strokes, there are two types, intracerebral hemorrhage and subarachnoid hemorrhage. The hemorrhagic strokes are much less common, but much more severe. They often lead to significant neurological damage or death. For risk factors, we want to minimize the risk factors to help decrease the chances of a stroke. The most common risk factors that can be addressed are hypertension, diabetes, high cholesterol, and smoking. Managing these stroke risk factors is going to involve addressing lifestyle changes and medications. Preventive measures greatly decrease stroke incidence and reoccurrence in most patients and in the population. Currently, the primary certified treatment for ischemic strokes is thrombolytic recombinant tissue plasminogen activator, which is also known as RTPA. This treatment is only effective within 3 hours of stroke onset, and unfortunately, its accessibility remains a significant barrier today.
My name is Luis Quinto, and this is the second half of the presentation that I will present on. The topic that we're going over right now is innovative therapies, in which there is pharmacological treatments that are in progress in clinical trials for the ischemic stroke, which the drug known as verapamil, which is a calcium channel blocker that reduces workload on the heart and relaxes blood vessels. They were also doing research. Scientists are doing research on neurostimulation, like transcranial magnetic stimulation, in which they use like magnetic fields to stimulate nerve cells in the brain, and they aid in the recovery of motor and cognitive functions after a heavy stroke. And these are not just specific to one, they can also be used for both. Depends on how much time has passed between the onset of the symptoms of the stroke, or how much time has passed after right after they were affected. The methodology for the research, right? For strokes is right. We look at genetic and environmental factors, right? We want to have so we thought about how, right, necrosis of neurotransmitters in the brain we can use a drug that can alter blood flow into the CSF fluid during hemorrhagic strokes, and this would help prevent reduced blood flow into the brain or limit its accumulation, right? You don't want to have the too much blood flow because then it kills all the neurons um, in the brain and neurotransmitters. The data collection strategies, right? Genetic testing, neuroimaging. Genetic testing would be including like blood samples that would be collected to analyze genes relating to blood clotting and vascular health, right? And so they will also do, right, the neuroimaging CT or MRI scans in order to classify which stroke they have, either ischemic or hemorrhagic, and right, in order to access the motor skills of a participant if they're paralysis, right? They're quadriplegic or paraplegic, then right, we'll use the National Institute of Stroke Scale um, that will be used to evaluate, right, stroke severity, neurological function, and degree of disability. And then they would also use the Fugl-Meyer assessment and Montreal cognitive assessment that wants to evaluate, right, the specific motor skills and cognitive function as well. Quality of life, right? And disability evaluations are also measured um, using a self-reported questionnaire to assess their quality of life, their physical function, and long-term disability or dependency resulting from a stroke, right? So see how the patients um, react um, to the test that they're going through, um, basically just see how their life is after they have a stroke, right? If they're improving or not improving, what is their mental state, and stuff like that. So implementation, ethical considerations, right? These are like where where we look at like consent, um, safety measures that are done on patients that we want to look at. Um, So some of the prerequisite steps we'll check, right? Family history diseases and drug history. Um, and we will see how they react to a certain drug, right? Um, Obviously, signed documentation and informed consent is also, right, is obviously need to tell the patients. You need to tell the patients about that. Obviously, death can occur. And some strategies for any regulatory approval, right? FDA, research universities, and other research government agencies have done tons of studies, and right, you would need like the IRB, right, for them to sign the consent forms, and to know, to make sure like, what are you doing in this study, right? And every process will be reported and processed to them and the subjects, the people, participating in the trials, right? They would require insurance, right? Medical insurance is very important in the US, and it could cover a bunch of things, like car accidents and medical medical problems. When you go to the hospital and get sick. Right, case of death, adverse side effects, and severe disability, and insurance, and private health insurance as well. So accessibility and economic impact. So how are the costs, right? How much does it cost to get treated after getting a stroke? Either hemorrhagic, if you survive through it, or ischemic stroke, which is more common, right? So according to the European Journal of Health Economics, post-stroke cares were the costliest in the US, right? 4,850 per month, right? Australia was $750 per month for inpatient, outpatient care. UK was 883 per month. Malaysia was at the lowest for $192 per month. So comparison, right, how patients, either inpatient or outpatient, how much it costs them, right? It depends on which country you're at, right? And according to another study, right, in Europe in 2017, right, uh, across 32 EU countries, they analyzed that $60 billion with healthcare accounting for 27 billion, right, um, was the cost for stroke. And so, they were also, put into, right, adding the cost of social care, annual related care costs were equivalent of an average of 59 euros per citizen, right? And it depends on which country you're in. right? And these statistics show that the certain places like the US and Europe, people cannot afford treatment for strokes, and so many of them do die to not receiving enough help, receiving that health care in order for them to be right rehabilitated. And yeah, it just depends on what your country has and what they offer you after after you receive this right after receiving stroke. So future and conclusion and future directions, right? So essentially, right, they strokes are one of the main leading causes of death and disability worldwide, right? Ischemic and hemorrhagic strokes pose a distinct challenge for treatment and recovery, right? Barriers to accessibility and intervention continue to hinder patient outcomes, especially in underserved regions, right? So, there's also research going into, like pharmacological treatments and innovative rehabilitation techniques that offer avenues for improving stroke management and enhancing recovery, right? For hemorrhagic strokes, right? Developing a new drug and aiming, right? At altering blood flow to prevent excessive blood accumulation in the brain and slow neuronal death, right? Is the way to prevent, right? A faster death, and try to seal up everything because it's usually a rupture. For ischemic strokes, a device capable of precisely targeting blood clots to administer thrombolytic therapy could show improve significant outcomes. So on the onset of the stroke, we can try to treat it as best we can and as fast and quickly as we can because the more time that you do not treat it, it's going to get worse and um, more cell death in the brain. And by integrating these early detection methods, personalized therapeutic approaches, and focus on genetic and environmental influences, it is possible to reduce the global burden of stroke, right? Improve patient outcomes, right? And ultimately enhance the quality of life for survivors, right? And always focus on the mental aspects, mental health aspects, as well as um, physical aspects um, if they're paralyzed. Um, and continued research and expansion of accessible care are essential to mitigate the long-term impacts of stroke on individuals and communities worldwide. And that is my presentation, and that is our presentation. And yeah, all the references are in the proposal paper, and they're cited correctly in our peer review. And thank you for listening to our presentation.